enough to say you want to, go for a course. You want to know what that course will do for you once you graduate. So I want to get that information, which I really couldn't get from even some of the lecturers that that taught me. Um, I think I was told anyway that I was one of the very few person who would, for example, come into Idiaraba when I was at, because in Unilag you have to be at the main campus for 1 year before you can then cross into the College of Medicine. But during that year, I actually went into Idiaraba, into the department that I was going to go to, just to ask questions from the lecturers. And some of them were like, that's unusual. That they've never seen someone come who has not even come here yet, come ask questions. So again, it really speaks to, you know, wanting that thing so much that you find out everything you want to find about it. And then with that information, I mean, of course, information is power. You're able to then rearrange plans as you go forward. So that's how I've really been able to go through the whole process almost seamlessly. I mean, of course, don't get me wrong, being a student wasn't exactly the easiest of things.
Easy.
Everyone have their own moments, and I did because I had my hands in many things. So well, I like to do that because it's not just about learning education. There are other things that you can learn to help you succeed. So that's how I've actually been able to do
So
it so far.
two major strategies I can hear from you is one, that one, is not a matter of a question, is pre-planning. You have to have a
Yes,
plan. But then
it's
from what you just talked about, being able to go to schools even before you got admitted, asking questions, knowing the fault, knowing what exactly is ahead, information and hunger for success, and then being able to use that information to plan. And I hope those listening can, pick this out. This is what I've noticed. I would also apply in my personal life is to have questions ahead and plan. Presently I'm writing an exam in a course in law because I majored in law, and
okay.
I'd registered for the course, taking classes, done tests before I decided to talk to a few friends about it. I'm just finding out that if I had pre-studied and ask the questions before would have been much easier. So I know this is a very key advice: pre-planning, asking questions ahead, and planning based on information rather than planning and then asking information later. Major for
Absolutely.
me. I'd like to hear, my next question will be on your passion for clinical research, because we're in a pandemic, and I always wonder what level of planning, what are Nigerians thinking, those that are professionals who can help? Why are we not churning out vaccines in Africa? Why are we not, finding the drugs, the cure for COVID in Africa? We are rich, and we have abundance of herbs and green alternatives. We have so much around us. We have our herbal medicines that have existed for generations before white colonialists came. Why are we not churning out you know vaccines from here? What exactly does it entail in clinical research to arrive at a worldly accepted solution like that, a drug or vaccine?
Yeah, thank you for that question. Wow, where do I start?
Sorry.
Wow. Yes, so you're very right. I have always known that we're blessed. We're blessed with so much natural resources, yet untapped. And even from when I was back, at the College of Medicine, I was actually, that much interested in, the herbs that we have that I supported one of my lecturers who brought together a conference. I think it was called the Conference on Ethnopharmacology. That conference brought together not only people from within Nigeria, but also herbalists. We call them herbalists. And it's not, the juju type of herbalist that we would typically think about, but herbalists are those that, are into herbs. People from across the sub-Saharan African region, West African region. So many of them came to the College of Medicine, and The conference kind of attempted to document a lot of those herbs and what they're used for, by the herbalist. What are the these herbs used in treating, and that you know that experience actually reinforced my choice of the course that I studied, pharmacology, because it kind of gave me that visibility. So but one thing I've always appreciated about our people is that especially our scientific community, is that they're very, very very hardworking and prolific. We are prolific publishers. We have several publications in journals, international journals. But unfortunately, all this information only stops there. Nobody has ever thought about taking it beyond that. And maybe if they did, they just probably never had the opportunity, to take it to that next level. That's what um, I have hoped to be able to do something about. And then with my experience within the clinical research environment, um, I figured that now is the time. As a matter of fact, I've actually been working on helping to change the narrative, because the clinical research and development spectrum is it's a wide spectrum. We have the preclinical part of it, and then we have the clinical part of it. What we've been able to do, um, fairly well, and I use the word fairly because there's a whole lot more that go into the preclinical phase, but we've been able to, um, within our limitations, document some of the activities of the herbs that we have. As a matter of fact, some foreign scientists will take that information and then run with it because they have, the
Yes.
systems and the infrastructure to do something about it. A case in question
Yes.
is the case of 9%. You probably are familiar with that. I had the unique opportunity of, completing my youth service, national youth service at NIPRID, the Nigerian Pharmaceutical Research and Development Institute in Abuja. And they came out with 9%. Right, I saw some of the data. Fantastic data. But they were able to piece together maybe part of the phase one, phase two. And they just couldn't take it further because there's no funding from the government. So unfortunately, at some point, a previous government sold the rights of this compound to some foreign company that did nothing with it. And they did nothing. Well, not that they did nothing. They actually took the data that was generated here in Nigeria and just submitted it. Yeah, they used it. They just submitted it. They put it together, submitted it to the FDA, and they received, the equivalent of what NAFDAC in Nigeria calls the listing. So that product received approval to be sold as a food supplement. You know, well, of course, the data show that it does work for sickle cell. But guess what? We are not getting the benefit of it. But that drug should be a blockbuster medication. So I often wish that I had the knowledge base that I have now back then, because would have been able to do a lot more. Unfortunately, this drug has lost the patency period for this drug has expired. So, but more work can still be done, and that's something that I'm hoping that I'll be able to do with my colleagues in NIPRID. So that's some of the challenges that we have. So we don't have, there's such a huge gap. The funding is not there. Yeah, you have some funding available from funding agencies, but those funds are grossly inadequate to do what needs to be done within the clinical phase of clinical trials. So that's a
You know,
major challenge that we have. You know,
I was actually
yes,
hoping that this would be a sort of ease flowing question, but you just gave me a shock. To think that we did the pre clinical research period stage that you mentioned, and we had something to work with, but we had to give it to the FDA, and just because we would not
yeah,
fund it. Because I don't understand, if we say we're funding something, why is the funding inadequate? Why are we making it inadequate? Whatever it costs,
Yes.
it takes should be completely provided. The entire cost to make it a drug, we could have, had that patent and be selling and exporting that product here from here.
Yes. Let
It's
me jump
sad,
on that real quick. Let me jump on that. See, I think part of the challenge around that is due to the lack of knowledge. When look, I've been very familiar with the work environment within Nigeria before I left. So we really don't have that knowledge, unfortunately. But when you talk to an average researcher within our academic institutions, they tell you that, oh, yes, they've done a lot of work with different schools and all of that. But then, within the industry, within the pharmaceutical industry, that work is classified under what we call academic research. You know, for those that have been able to do, some amount of clinical trial like work, um, those work are classified as investigator initiated studies or trials. So there's a whole lot of funding that goes into it. It's a very expensive venture, and that's why you find that only the developed countries, you know um, companies in those countries are the ones that are participating in this. So the first thing is that lack of knowledge about what the clinical research process is all about is a major impediment. And then, of course, because of that, you know, people in government that would typically maybe help advocate for funding are not able to do that because they cannot justify, whatever that request will be. So but that is changing now, and that's the kind of work that I've been doing for several years now. So it's changing. We're beginning to have that kind of information come into our fold. And thankfully, like I've been fortunate to have gone through the industry for over 20, upwards of 22 years now, and all aspects of the clinical phase of um, clinical trials is well understood by me. And so my life goal really is to help pass a lot of that information to our people. So we've been at that for about maybe 7 years now. We've been, just training people at different levels. But we're now set to take it to another level where, we make it available to a whole lot more people, so that we can get to that critical mass of people that have that knowledge, not only within the medical community, but also within the scientific community. And then, of course, thanks to COVID-19, there's a whole lot more people that tend to, well, I mean, no pun intended. I say thanks to COVID-19, but, COVID-19 is not exactly a good thing. But
It's not
sometimes it is in that kind of situation that you
that you
learn
find a good
something. Yeah. So,
yes.
and that's what I think we've been able to achieve within the last 2 years. So more people are aware of what clinical research is. People are raising more questions. They're even hungry for that information, as opposed to what we were doing, trying to raise awareness. So we just need to step that up a little bit more and bring that information to more of our people so that we can then easily bridge that gap. And then that's what we've been working on for some time. So I'll stop there for a moment.
Thank you so much, sir. But I would not like to let you go like that without, inspiring the younger ones. You talked about your participation with KB Club, and in this interview, I've heard you talk about mentoring young ones. What would you tell a younger person out there, someone who is just stepping into campus, someone who is aspiring to be a Dr. Fashina, someone who has dreams, what would you say they must do first? How would you tell them to see success and failure? You know, I'd like to learn.
Okay, good question. So I think for me, the very first, like I've said over and over, during this interview, is you need to plan, and planning sometimes also comes from knowing exactly what you want to be. So you have mentors, people that you know, that you aspire to be like. You want to be a Dr. Fashina or Dr. Butali. Certainly, you have to get education. So getting your grades up opens doors for you. I mean, yes, not everything is all about grades, but there are opportunities. There are tons of opportunities that are actually waiting to be tapped into, literally begging people to come. But because sometimes our people are just not prepared, maybe due to lack of education and maybe lack of planning, we're not able to access those opportunities. Um, so what I would tell the young ones is that, look, you need to be sure, identify what your area of interest are. Identify it early, and then find
Um,
someone who you can rub minds with, somebody who can encourage you, a mentor who can show you the rope, someone you want to be like. Ask them questions because information is very important. I
it's
do
true.
that regularly, even without solicitation about for it. I give information because, look, I'm always happy to see all of us rise together because that's when we're stronger. So our youth need to have that inquisitive nature. Ask questions about
Ask
what you want
questions.
to be. So once you have that down, please write it down. It's very important because, yes, as brilliant as we all are, we all forget things. No matter, even if you're an Albert Einstein, you forget things. So, but when you write it down, you're able to refer back to it, you're able to adjust it, and you plan with that. You put a time to it. You have to be able to measure your progress. Put a time to it, because with that, you'll be able to then move forward as much as possible. So, I personally, I mean, I give a lot of talks. I actually make it a point to come back to the College of Medicine, University of Lagos, at least once a year to speak to the student population, talk to them about you know the opportunities that abound in the field of clinical research. So, and it doesn't matter what you study, whether medicine, dentistry, or any of the other science-based basic sciences. So long as you're sure this is what you want to do, just run with it. Just run with it. So I talk to people as much as I can, show them the opportunities, and I welcome them to I have tons of people that reach out to me, and I'm happy to share with you that, look, there's a lot of brilliant students who were just waiting for this kind of information to be able to move to the next level. And I can tell you that I have several such students who have been able to access full funding full funding scholarships into foreign institutions just to move them, to that next level. And I provide support. So that's the kind of thing I do, and certainly I encourage a lot of people who are maybe in similar positions as myself. And I know my friend, Dr. Butali, also does something like that. So that's what we need to continue to do to encourage the younger ones, because sometimes it is that person that looks like you who would be able to pull you along. If you're relying
Exactly.
someone else, I mean, you are just going to be one of maybe a million faces from different parts of the world. But if you have somebody that looks like you, who you can relate to, who is actually from your alma mater, that person will be happy to, and we do a lot of that. So that's my advice to the youth.
I must commend you, but before I let you go, we must be able to find you on social media. Do you mind sharing your social media accounts with us?
Um, okay, well, I don't know which ones you want. So I do have a
Okay,
few.
Facebook.
Um,
Let's start with Facebook.
Facebook. Uh,
Okay.
well, Facebook, you can find me. Actually, you can find me on Instagram as
Okay.
dot
Okay.
wale.fash. That's my handle on
Okay.
Instagram. On
Okay.
LinkedIn, you can just put my name there, Adewale Fashina. You know,
Okay. Okay.
I'll come out, like pronto. I'm not a Facebook person, so I wouldn't
Okay.
even venture to give out Facebook because you wouldn't find anything. anything
Yeah.
worth looking at
But
over there. But LinkedIn
LinkedIn
as well.
and Instagram are good. But however,
Yes,
do you have
LinkedIn.
mentoring
Yeah.
groups aside KB Club that you mentor young
Um,
ones?
I actually do have an ongoing training program that I shared, with the world. Yes, as a matter of fact, I have one that I will be conducting, you know, all of next week, starting Monday, and I'm, doing
Okay.
that in collaboration with the University of Lagos, the Brains team.
Okay.
But there
Nice
is an
team.
ongoing training which we've been doing for the last 7 years. So yes, I encourage people to reach out to me. If they have questions. My email is adewale.fashina@fashfarmer.com. Fashfarmer spelled
Mm.
Pharma. Well, Fash is Pharsh
Fresh
dot.
farmer.
Yes, Fash Pharma, as in pharmaceutical. So
Dot com.
fashpharma.com.
So
So that's
Adewale dot
Adewale
Fashina
dot
at
Fashina at fashfarmer.com. Fash Pharma is one word.
freshfarmer.com.
Yes.
Okay, one word.
So
So
you
that's
can
your
reach
website.
me.
So
Yeah,
and the,
you can reach me.
the mentoring initiative that you'll be doing starting on Mondays with the University of Lagos is called Brain Team.
Well, it's a clinical research training. It's actually an actual training.
For the student, only
There's a
students within
call.
the
No, it's
University of
actually
Lagos,
open.
or it's
It's
open.
open to just about
Okay.
any student or any researcher. It's open to the medical community, the scientific community, even the students. So it's open to just about everyone. And there is currently an ongoing call for people to register. Because the slots fill up pretty fast. So I would
Okay.
encourage those listening to plug into that. And it doesn't matter. To be honest with you, it really doesn't matter whether you are in the medical or scientific community. Those that have non-medical careers too have
Can learn, can pick up one or
opportunities
two.
in this. So I would encourage them.
Thank you so much, sir.
Yes, yes. I'll
Thank you
I'll
so much
encourage
for
them
joining
to
us.
plug into
I
that.
would quickly just Okay, I would quickly
Thank you.
just talk about your social media handles, because the objective is, of course, no matter when this interview airs and or someone comes in contact with it, that they're able
Yeah.
to learn and find you. So LinkedIn is Wale Fashina on LinkedIn, simple, and on Instagram it
No,
is
no.
Wale.
On LinkedIn,
Okay,
it is Adewale Fashina. That's my full
okay,
name.
Dewale Fashina. Okay, Dewale
Adewale. Adewale.
Adewale Fashina.
Yes. Adewale. And then my last name is Fashina. Fashina.
Okay, I'm so sorry about that. So on LinkedIn is
Yeah, I think you're breaking up a little bit.
Yes, sorry, our internet was a bit shaky. I was just talking about the event for Monday, the 7th of February 2022. That is a
Yes,
wide opportunity for anybody, no matter your field, to get in
that
contact
is
with
correct.
Dr. Wale Fashina and learn and be mentored. And it's open to anybody, no matter the school that you're in.
Yeah.
And I must say that I'm very, very impressed and happy, because my guest today is not only a Nigerian, an entrepreneur, but he's a patriotic Nigerian, someone who's out there but looking back home and trying to make this place a better place too. So thank you so much on behalf of the management of Agbari Multimedia. I want to say thank you for your time and those impactful counsel that you just shared with us. Thank you, sir, for
Well, thank you
joining.
so much. Thank you so much for giving me the opportunity. Thank you.
Thank you. I hope we'll call you next time you'll be available for us.
No, absolutely. Anytime, completely.
Thank you.
I'll be happy to. You know.
Thank you so much.
Thank you.
All right, sir. Have a nice
Bye
day.
bye. You as well.
Bye. The viewers watching, Agbari Multimedia family out there, I must say thank you for joining and watching. And anytime you're watching this, don't forget to like, share, and comment. If you're watching on YouTube on our channel, please leave a comment, a feedback, or a commendation, whatever you'd like to share. We're also on Instagram, Twitter, and Facebook. Please leave a comment whenever you feel like. And if you learned something today, I hope that you apply it and that I hope that we've made impact in your life. Till I come your way again next time, I am Nima Akashat Zibiri. Be inspired by this interview and get ready to be the next Amazon or Afripreneur, or let me put it better, be inspired by this interview and get ready to be the next Amazon and Afripreneur to be celebrated here on this platform. Thank you for watching.
We are not here for food. Gaskiya.
The family has concluded that you forget this building with your children.
It's still this inheritance issue. My in-laws are bent on taking everything from me because my children are girls.
If you ask me, I would advise you better listen to them and do what they say.
Muhammad Rasulullah sallallahu alaihi wasallam.
I will deal with them.
Talk to her to heed to the family's directive, or else.
Or else what?
Have you ever thought of me writing my will?
Will? How? Where? What's wrong with you? Are you okay? He did not write a will because he didn't know he was going to die.
Writing my will doesn't mean that I want to die.